My wife and I were in Kansas and visiting my granddaughters, and we were playing like we normally do, and she just didn't play like she normally did. She didn't act like she normally did. So I got out of grandfather mode and went into doctor mode and started examining her. Realized there was something potentially going on.
One of my children, when they were a year and a half old, developed croup, cough, cold-like symptoms. And within 2 hours, I was rushing my child to the emergency room.
I have a husband who's on warfarin, which is a blood thinner. His cardiologist wants the INR at 2.5 to 3. The last month that we got it, he had one that came out 6.
Once we took her to the hospital, she had lab tests that showed that she very possibly had leukemia. Here was a 4-year-old beautiful girl who was the love of a lot of people's lives, who suddenly had a illness that 10 years ago would have been fatal 95% of the time.
It basically, over a couple of hours, ended up being an emergency trach for my child. Because of the laboratory results that came through, the physician was able to institute appropriate therapy for my child.
He had already taken his Friday dose when I got the lab back, so we skipped Saturday and Sunday and then got the result on Monday, and it was 1.2, which is dangerously low, which means probably, almost certainly, that 6 was never true. So it's important that laboratorians and everyone understand people live and die by these things.
She underwent chemotherapy that's getting to be pretty standard in this country, and about 5 years ago became cancer-free, and now has finished her first year at Kansas State University.
When I could see the impact of the laboratory results that came through for my child was an awesome moment to say they truly are an effective part of the patient care team.
I'm John Daly. I'm a physician specializing in clinical and anatomic pathology. I had it as my practice every day to walk over to the post office that was 2 blocks away. One day I walked in and one of the gentlemen came over to me and he said, "I want to say thank you very much for what you did." He said, "Do you remember a breast biopsy on a woman that you sent to a breast pathology expert?" He said, "That was my wife." And he said, "We very, very much appreciated the fact that you took the time to get an additional opinion on the case." It really hit me right between the eyes that behind every patient specimen, there's a real live patient. It's not just a breast biopsy. It's not just a blood sample. It's a patient. Laboratory testing matters because so many of medical decisions are based upon the results of the laboratory testing.
Because we form our diagnoses based on lab tests over 2/3 of the time.
Because it does assure positive healthcare outcomes.
Approximately 60 to 70% of medical decisions are based in whole or in part on the result of a laboratory test.